I need you to hear this clearly, because the numbers for 2026 are not just bad news. They're a warning shot. Medicare Part B is about to eat one of the biggest chunks out of Social Security checks we've seen in years, and the raise seniors thought they were getting in 2026 is already disappearing before it reaches their hands. If you're counting on your Social Security COLA to help you breathe easier next year, the truth might shock you. Most of that increase is already gone. Let me walk you through exactly what's happening, because this isn't rumor or speculation. These are official numbers coming straight from the government agencies responsible for setting Medicare premiums and Social Security benefits. The Social Security Administration has confirmed the 2026 cost of living adjustment at 2.8%. Nothing huge, nothing impressive, just a modest bump that reflects the inflation numbers from the CPIW index. On an average benefit of around $2,000 a month, that COLA gives roughly a $56 increase. It's not a life-changing improvement, but it's something, just enough to balance out the rising cost of groceries, utilities, transport, and everyday living. But here's the part they slide in quietly. Medicare. Part B is jumping from $185 in 2025 to $202.90 in 2026. That's an increase of $17.90 every single month. And because Medicare premiums get deducted directly from your Social Security check, that $56 raise becomes more like $38 in real life. Before seniors ever see their money, Medicare has already taken nearly 1/3 of the increase. So when people talk about the good news of a COLA for 2026, understand this. Medicare is swallowing a huge portion of it, and most retirees won't actually feel like they're getting a raise at all. And the pressure doesn't stop there. Medicare is not only raising the monthly premium, it's raising the deductible too. The Part B deductible climbs from $257 to $283 in 2026, which means before Medicare pays anything, seniors must pay even more out of pocket. None of this is random. None of this is accidental. The Centers for Medicare and Medicaid Services, CMS, makes it clear that rising healthcare utilization, higher doctor payment rates, and increasing medical service costs are pushing premiums upward. Healthcare inflation is outpacing every other form of inflation, and seniors are the ones carrying the weight. The hardest part of this entire situation is how invisible it looks on paper. The government releases one announcement saying COLA increase, another announcement saying Medicare premium update, and at no point do they say clearly that both numbers cancel each other out. But in real life, for the actual people depending on these programs, that's exactly what happens. The COLA isn't a bonus, it's not extra money, it's not meant to make anyone richer. It's only meant to keep up with inflation. And when Medicare raises its premiums faster than the COLA, that whole purpose gets destroyed. If prices are rising, and Medicare costs are rising even faster, then seniors are falling behind even though their benefits are technically rising. Let me stretch this out and dig deeper into the real mechanics behind what's happening, because this Irma story isn't a side note. It's a major pressure point that hits millions of retirees who happen to fall just slightly above the income cutoffs. These are not the ultra-wealthy. These are school principals, retired engineers, small business owners, people who saved responsibly their entire lives, only to find themselves punished by the system the moment their income crosses a certain line on the IRS chart. The IRMA brackets for 2026 are a financial punch that many retirees don't see coming. A single dollar over the limit can push someone into a higher bracket, meaning they pay dramatically more for the exact same Medicare coverage that everyone else receives. And the numbers are brutal. Premiums climbing to $244, $349, $454, $569, and all the way up to nearly $700 per month for the highest tier. When you combine that with the base Part B premium of $202.90, Some people are handing over close to $8,000 a year just for Medicare Part B alone. That doesn't include Part D drug plans, Medigap plans, Advantage plans, deductibles, copays, dental, vision, long-term care, or anything else. The reason IRMA hits so hard is because inflation-adjusted income doesn't rise fast enough to keep people safely inside their current bracket. COLA bumps income upward slightly each year, but IRMAA thresholds don't always rise at the same pace. Some years, the bracket limits barely move. Other years, inflation calculations push retirees into higher taxable income categories, even if their real purchasing power declined. It becomes a quiet trap. People who are not getting richer end up paying premiums designed for high-income earners simply because of technicalities in adjusted gross income rules. And the lack of hold harmless protection makes this sting even more. Hold harmless is a safety net built into Social Security to prevent monthly checks from shrinking due to rising Medicare premiums, but the safety net only applies to people paying the standard premium. The moment someone is in an IRMAA bracket, that net disappears completely. Their Medicare costs rise by the full amount, even if their Social Security COLA can't cover the gap. No cushioning, no soft landing. If the premium jumps, their check shrinks, period. This is why so many retirees feel blindsided. They hear that Medicare premiums are going up by $17.90 for the base Part B plan. But they don't realize their IRMA surcharge might jump by $25, $40, or even $60 on top of that. A small COLA increase is irrelevant when the combined premium increase is double or triple the size of the raise. And remember, IRMA is based on tax returns from 2 years earlier. So someone who sold a house, cashed out a retirement account, or received a one-time payout in 2024 might suddenly get hit with the highest level IRMA premium in 2026, long after that income is gone. They pay the price in the future for income they no longer have. Now layer all of this on top of real-life inflation. Every government report tries to convince people that inflation is cooling or moderating or stabilizing, but nobody at the grocery store feels that the seniors walking through Walmart or Publix or Safeway aren't imagining the higher prices. They're living it. Eggs, milk, produce, bread, meat. Everything costs more. Auto insurance has gone up. Home insurance has gone up. Rent and property taxes have risen across most of the country. Electricity costs more, gas and heating fuel cost more. Prescription drugs cost more, even with Part D coverage. And now Medicare, the very program meant to protect retirees from medical financial ruin, is draining a larger slice of their monthly income in 2026. When someone hears 2.8% COLA, it sounds decent on paper. It sounds like progress. But you can't spend a percentage. You spend dollars. And when those dollars show up already sliced down by Medicare, it feels less like a raise and more like the system taking money with one hand and returning a few coins with the other. That's why retirees describe the yearly cycle as emotionally draining. It's not just financial stress. It's the mental weight of knowing that no matter how hard you planned, no matter how carefully you budgeted, no matter how much you saved in the past, every year pulls the rug out a little more. This is where the long-term trend becomes the real warning. Healthcare inflation is a beast that refuses to slow down. It grows faster than normal inflation, faster than wages, faster than Social Security benefits, faster than government projections. As long as healthcare costs keep climbing at this pace, Medicare premiums will follow. And as long as premiums climb, Social Security checks will lose value. It's a mathematical imbalance that compounds over time. The system isn't breaking suddenly, it's eroding quietly. Experts have been sounding the alarm for years, saying that Social Security and Medicare are moving farther and farther out of sync. The programs were designed in different eras, using assumptions that no longer match modern healthcare realities. Life expectancy has risen. The number of chronic illnesses has risen. The cost of hospital services has shot upward. Prescription drugs now cost 10 to 20 times what they did a decade ago. In some cases, medical advancements are incredible, but they are expensive, and Medicare's funding has no choice but to chase that cost curve upward. Retirees feel the widening gap every month. Their checks rise slowly, steadily, predictably. But Medicare premiums rise in jumps, sharp, sudden, unavoidable. And deductibles rise too, meaning out-of-pocket costs also increase before Medicare even starts covering anything. When premiums climb and deductibles climb, retirees get squeezed from two sides at once. It's not surprising that so many people say their Social Security raises feel like they're shrinking each year. This is the dangerous part. Once the gap between Social Security and healthcare costs becomes wide enough, even small increases in Medicare premiums start to feel catastrophic. A $17 jump shouldn't be life-changing, but for someone living on a fixed income, it is. And for someone in an IRMAA bracket, paying hundreds per month, it's even worse. The system expects retirees to absorb medical inflation without giving them the income growth needed to match it. The 2026 numbers are not just statistics. They are a snapshot of a larger trend that is accelerating. Social Security gives with one hand, Medicare takes with both. And unless reforms are made, real structural reforms, this annual tug-of-war will continue tightening around retirees' budgets. The financial burden doesn't fall in a straight line. It falls in layers, and each layer cuts deeper into fixed incomes that can't expand fast enough to keep up with rising costs. This entire situation is a reminder of something uncomfortable but important. Retirees are expected to carry the cost of a healthcare system that is outgrowing the income system designed to support them. Medicare premiums, IRMAA, surcharges, deductibles, and copays aren't just numbers. They're month-to-month reminders that the gap is widening faster than anyone expected, and 2026 is another step in that direction. CMS isn't hiding the reason. They're saying openly that medical spending is rising because of higher utilization, more advanced treatments, more chronic conditions, and more expensive diagnostic testing. Modern medicine saves lives, but it is also expensive, and Medicare has to fund those treatments. But when that funding is pulled from retirees' Social Security checks, it means retirees are funding the shortfall with their own benefits. Let's be brutally honest. A 2.8% COLA is not enough to outpace the rise in healthcare costs. It barely keeps up with standard inflation, let alone medical inflation. That's why the 2026 Part B increase hits so hard. It's not about the number itself, $17.90. It's about what it symbolizes. The system meant to support seniors is now squeezing them from both sides. Their income rises slowly, their expenses rise quickly, and healthcare rises fastest of all. And this isn't happening for the first time. In the last decade, premiums have more than doubled. Seniors are already paying far more than previous generations ever had to pay. For Part B, deductibles have risen, copays have risen, drug prices have risen. And every year that Social Security tries to keep up, Medicare raises costs faster. When these two programs drift out of sync, the people caught in the middle feel it immediately. I want to highlight something else most people don't realize. Not everyone is protected by the hold harmless rule. New Medicare enrollees aren't protected. People on Medicare Advantage aren't protected by the same mechanics. People with higher incomes aren't protected. People who delay Social Security benefits aren't protected. That means millions of seniors will feel the full force of the 2026 increase with no shield whatsoever. And while all of this is happening, we're heading into another year where medical companies, hospitals, and drug manufacturers are reporting higher revenue due to increased demand. Meanwhile, seniors, who rely on these services the most, are stuck watching their fixed income get chipped away from every angle. It's a strange paradox. Medical progress improves life expectancy, but the financial burden of staying healthy keeps climbing faster than income does. The bigger question here, the one nobody in Washington wants to answer, is simple. How long can this keep going? How long can Social Security growth stay slow while healthcare costs explode upward? How long can retirees manage rising premiums, rising deductibles, rising copays, rising prescription prices, and rising everyday inflation without improvements in income. There is a breaking point, and while no one has announced it, millions of seniors are already feeling dangerously close to it. The 2026 Medicare Part B premium increase may look like a normal adjustment on paper, but when you match it with the 2026 COLA, the real-life impact becomes clear. The increase eliminates a large part of the raise. It reduces the value of Social Security. It shrinks retirees' buying power, and it continues a trend that has been hurting seniors for years. People deserve to know the truth behind the numbers, not the sugar-coated version. They deserve to know why their check isn't stretching far enough. They deserve transparency about how their COLA is being absorbed by Medicare before it reaches them, and they deserve accountability from the system that claims to protect them. The message for 2026 is crystal clear. Social Security is trying to give a raise, but Medicare is taking most of it away. And unless something changes in how these two programs balance each other, this won't be the last time this happens. In fact, it's the early sign of a larger financial struggle retirees will continue facing every year moving forward.